Hi, this is Dr. Steve Weiner from the Aesthetic Clinic, and today we're going to talk about Artefill. And Artefill is a permanent filler that has been shown to last at least 5 years. And it's been on the market for several years, but we just started using it because we wanted to see how it has been doing in other patients before we started using it. So Artefill is made up of a combination of collagen and PMMA, polymethyl methacrylate. Polymethyl methacrylate is an inert substance, which means it doesn't get degraded by the body, and it stays there and it creates a collagen response by the body, and that's what gives you the long-lasting fill. So the collagen, which is added to it, is added only as a carrier to assist in its injection, and it lasts for only about 3, 4, maybe up to 6 weeks. The only caveat with injecting the collagen with the PMMA in the Artefill is that you have to do a skin test. And the skin test is done approximately anywhere from a week to a month before you have the procedure done. And that's just to see if you have an allergy. It's a very, very low probability if you have an allergy to collagen. It's probably in the tens of thousands of 1 in 10,000 or so. So what we're going to do here is we're going to inject Artefill, and we're going to do it in what we call a kit. A kit is 5 syringes, and that's typically what we use in a patient when we do Artefill. And Janice here, she works for us, and we've been noticing that her cheeks are sinking a little bit, so we're going to give her a little cheek lift with the Artefill. She also has lost a little bit of volume in what we call the pre-jowl sulcus, which is right here, a little bit in the chin crease, and then we're going to fill this area back here in the back part of the jaw, because what happens with the jaw as you get older, it goes from this to this. You start losing the bone in what we call the angle of the jaw. So we're going to try to recreate that angle of the jaw back here. I'm going to use a blunt cannula, which I use for all my fillers. And I've already put little bitty holes where I'm going to start the blunt cannula. So we'll start right here with the right cheek. And we go in, and this has lidocaine already mixed in, and so it's a very comfortable procedure for the patient. And as I'm doing this, she's going to get number. And her cheek's going to improve here. You doing okay? So we're almost halfway done here with the upper cheek. And so as you can see, her cheeks are now a little bit fuller on that side. So then we'll move on down. For our second syringe here. And we're going to go here. And we're going to go in the pre-jowl sulcus area. And this is just filling that little gap that you see. and the pre-gel sulcus right here. So that's pretty good. And then I'll come over here and I'll do the jawline. Janice is great because she doesn't take any supplements, so there's very little bleeding here. There's a little bit. Sorry. Sorry, Janice. Okay, so we've now put in 2 syringes, one in the upper cheek and one in the pre-gel sulcus and one over here by the jaw. So we'll basically do the same thing to the other side. Janice, you doing okay right now?
Oh, yeah.
Okay, good. There's a little bit of areas that it might have caused a little bit of discomfort. Usually we have a second hand, but the second hand is actually helping film, so. Anyways, so if you want to know more about Artifill, the permanent filler that stimulates your own collagen and has been shown to improve over the next 5 years, not just improve immediately, but it continues to improve over 5 years. Give us a call at the Aesthetic Clinique, 850-622-1214. Thank you.